Hey guys, I'm Cassie and I'm here today at the CSA Medical Clinic here all the way in Angeles, Pampanga. And I will be having my one-on-one consultation with the one and only Dr. Contessa. So, why am I here? Well, actually, I have been bothered by my facial symmetry. So, hopefully, I get to talk to Doc about it and, looking forward to the assessment, especially my eyes, my eye area, and my lips. And by the way, guys, don't forget to click subscribe and the notification so you get to be updated with all the new videos that will be coming your way from Doc Contessa.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll be doing a combination treatment for the lifting of the corner of the eye, for some lip and chin enhancements for Miss Cassie.
Hi guys, I'm Cassie and Doc, thank you so much for having me today. I'm so excited and looking forward for the improvements because maganda na pero may gaganda
she's
pa.
already beautiful. It's just an enhancement. Usually for the young ones, what we are doing is highlighting those beautiful features of the face, okay? Like for Cassie, I was doing an assessment a while ago on the upper third of the face. There's a very good convexity of the forehead already. It's just that on the temple region, and it's something genetic, okay? So the temple area already has this beginning hollowness or like it's already sunken. So I was explaining to Cassie that it could be inherited, okay? And then what's happening when you have this volume loss here or that sunken or hollowness of the temple, it creates that hooding effect on the upper eyelid or the corner of the eye. She's still young, okay, in her 20s, right?
Yes.
So as time passes by, you'll notice that there's more of this drooping of the corner of the eye because of the lack of volume on the temple. That's why we wanted to do something that will lift that and correct this temple hollowness. We'll restore the fullness of the temple. Okay, we'll do a combination treatment for that. And Cassie told me that she has a low tolerance to injections. So we'll do something to numb the skin before doing the procedure. Now, mid-face section, I was checking on her under eye a while ago, the infraorbital hollowness also. Okay, I think because she's still studying, so sleepless nights would create this hollowness under the eye.
Very relatable eye bag.
Exactly. Okay, and so far she has that good OG curve on her cheek. She's still young. Okay, love it whenever she smiles. Okay, that's a good thing. Okay, and then on the lower third of the face, I noticed, I was sharing with Cassie because female face, the shape of a female face is a so-called inverted triangle or the V contour or smaller on this lower third of the face. So genetics again, she kind of have this squarish, right? So we could feminize the shape of the face, okay? It looks good on her, okay? Kind of like still improving that shape of the face. And The lip region, we wanted to do minimal enhancements. She has that good shape already, okay? Just to restore volume again and contour again in a minimal way. And on the chin region, I was explaining to her, kind of like she lacks the vertical dimension, but when we did the Ricketts E-line, she has the good projection. So we will just be improving a bit on the chin apex. Non-surgical way.
Yes.
Okay? I'm excited, Cassie.
I'm excited more.
Okay, so what kind of treatment, what procedure, we'll show you when CSA Medical Aesthetics return. And we're back, so we're now at the part of doing the procedure for Cassie. Before the methodology, we'll be doing the so-called anatomical landmarkings, okay? So we'll be working on the temple region, okay? So temple area demarcations, your temple fusion line, lateral orbital rim, and the superior border of your zygomatic arch, and posteriorly the hairline region, okay? So we said that we will restore the fullness of the temple via injecting a hyaluronic dermal filler. So my demarcations for my injection point will be 1 cm perpendicular to that fusion line and 1 cm perpendicular to the lateral orbital rim. So this will be my injection point here, okay? Now, apart from that, I'll also do the so-called fox eye thread lifting. Our entry points will be 1, 2, 3, and the vector will be towards the hairline of this temple region. Okay, so that's for my temple correction, temple fullness correction, and also lifting of the corner of the eye. Now, we'll also be doing the lip region. What I'll be working on for Cassie is just to enhance more of the lip border or the so-called vermilion border. We'll just be doing a simple technique of a linear threading technique here, okay? Because she already has good lips, okay? So it's just making the vermilion borders more pronounced, or rather like contoured, or give that also good cupid's bow, okay? Restore all those demarcation lines for the lip borders, okay? Now for the chin region, just a simple method. I'll just be injecting into the chin apex. So when I do that, make a midline marking like that, a center marking, straight marking like this, and the chin apex will be my injection point region. Simple methods, okay? So let's start with the methodology. So after doing those anatomical landmarks, we also do like a numbing of the skin. We applied topical lidocaine cream a while ago, left it for about 15 minutes. You can leave it even up to 30 minutes. And then we also did a so-called nerve blocks, supraorbital, infraorbital, mentalis nerve block. So we can like work on the upper, middle, and lower third because we're doing temple, we're doing the lips, we're doing the chin, okay? So for the technique part, okay, so we'll work on the right temple first. So Cassie, towards the left side, please. So I had my markings a while ago here. I'll fill it in with the hyaluronic dermal filler, High G Prime. So we have this high molecular weight type of brand. And then onto the bone, insert, onto the bone. And then it's my habit to still aspirate, but I stay onto the bone, okay? So this is a large particle size, high viscosity type of a filler. And then I'll just fill it in with a 1/2 ml of this product. So pushing towards the bony region. Again, 1 cm perpendicular to the temple fusion line and 1 cm perpendicular to your lateral orbital rim. So filling it in with 0.5 ml of my hyaluronic dermal filler. And we know that hyaluronic is a natural substance present in our skin, in our tissues. It's a biocompatible, biodegradable type of a product material. So it will also help in restoring volume and fullness on this part of our face, the temple region. It is hydrophilic, it attracts water. So Cassie, you need to hydrate, drink a lot of water so it will still plump up or kind of expand inside. So I'm already nearing the 0.5 of this product. So it's a slow push because this is a thick, viscous type of a gel, and we want to restore volume for the temple area. There you go. So pull out. Next, I'll do my so-called Fox Eye Thread Lip. So we already did the filler injection, and then I'll still numb my entry point. Sponge, please. Okay, that's a tiny lidocaine for the entry point. Okay. Just the lidocaine for the entry point, Cassie. Okay, inhale, exhale, a little bit here, just a little bit there, and then I'll use an introducer needle, like you can use your gauge 21 there, and I'll use a COG PDO thread 60 mm in length. So this one I'll just direct on to the temple region hairline. Okay, it's a vertical, kind of diagonal vertical approach. Okay, gliding it towards the hairline region, and then after you place it there, normal to feel like there's something like a pressure. Okay, so need to reach the highest point. Okay, there you go, and release. Next is a second thread. Okay, and then our introducer needle, and we're gonna insert and then glide again towards the temple region. Inhale, exhale. So I didn't already inject a lot of lidocaine in the track of the needle because I did the supraorbital nerve block, because the lidocaine kind of sting also. So I will just direct it into the hairline, feeling of like having the, you can still add some lidocaine there. Okay. Aspirate and push a little bit of my lido in here. Of my lidocaine, and add some more of the push or the glide, advancing my cannula. Okay, so because Cassie has kind of like a low tolerance, so just advancing a bit this cannula onto the hairline area. Okay, and a last one, I'm just gonna be using 3 hard threads for this area, and I'm gonna make another injection for the entry point, the third one, and then gonna glide into the space. Okay. So we have the filler a while ago, which has lidocaine in it, and it helps in also numbing the region. So just gliding hairline area towards this scalp region here. Okay. And then a bit of push. Okay, there you go. And then pull out. Then a technique to kind of do a reverse pull to create that fox eye effect, and then cutting, and then cutting and cutting. So let's do the lip enhancement. I'll pinch this area of the philtrum region, and then a tiny prick there. Inhale, exhale, tiny prick, and then we're just gonna be restoring the contour of the vermilion border. Okay, just a tiny push there, and also here. Again, the lip injection should be done in the right anatomical layer. Take note of the vascular tissues. OS, please. So we have labial vessels here. OS, please. Pressure. It's normal to see some pinpoint bleed there because of the labial blood vessels. Okay, on the lower lip, what I do is place on the center a stick or cotton applicator stick, so we can still restore that good tubercle of the lower lip region. Inject onto the lower tubercle here. This is the right lower lip tubercle, and gonna push a little bit of my product there just to maintain that good lower lip tubercle, and then proceeding to the lip line and a little bit. There you go. Just tiny pricks in here. Okay. So I'm just injecting little amounts because we don't want to have that overfilled lips for Cassie. And then I'll proceed to the chin apex to improve that vertical dimension of the chin. Okay, this is just a simple technique. Okay, center of the chin, okay, into the apex, reaching that bony area, symphysis menti. Okay, aspirate a bit, and I'll just be injecting about 1/2 ml of my product here. Okay, pushing this high G prime, viscous, thick, large particle size hyaluronic dermal filler. Okay, so these are substances that were stabilized by a so-called cross-linking to make them longer lasting, durable, and not easily degraded or broken down by our own natural enzymes. Okay, pushing a little bit more, and this is just to improve that vertical dimension. And I also noticed that there's a submental bulge for Cassie, so I was advising her to do a further treatment on the chin and jawline to get rid of the so-called double chin. Okay, so we've done the right side. Let's proceed to the left. We're almost done. We're finishing with the left lower lip region. Since we already finished the chin apex, we'll show the result to Cassie when CSA Medical Aesthetics return. And we're back. We'll now show the result to Cassie. Cassie, here's our mirror.
Okay,
So these are, yes, combination treatments. Okay, Cassie, temple, lips, chin. There you go. Yeah.
Oh,
Yeah. So lifting the corner of the eye, enhancing a bit your lips, and making your chin that feminine rounded shape in a non-surgical method and a simple technique. So there you go. So as a review again, we did hyaluronic temple, thread lifting on the corner of the eye, and then some lip enhancement with our hyaluronic filler kiss, plus the chin with our high G prime dermal filler hyaluronic also. So Cassie, what do you think?
Grabe, the chin is so beautiful.
Yeah, and
the lips pantay na.
are natural.
Kasi,
Yeah, she was sharing with me she has asymmetry on her lips also. Okay. So for now, the corner of the eye, a bit with those injection marks, okay? We'll cover it later on with some of our sterile strips there. And then kind of feeling tight in the area and kind of like feel that,
like lifted.
yes, the stretching also. And still the effect of, we did a nerve block a while ago, still with the effect of the nerve block. So as of now, you're still numb, okay? And Cassie still has to, like, later on, she has an activity or a meeting later on. So this is a treatment that you can do, like a lunchtime treatment, coffee break treatment.
Actually, really quick lang. And
quick
then continue
procedure.
with life.
Exactly, okay. So actually, I was also sharing with Cassie, we'll also do a feminization of the shape of the face. Okay, we'll work on the angle of the jaw, the jawline area, and further working on the pre-jaw region to reduce that or remove the double chin effect. Okay, so Cassie,
Doc.
any message to our televiewers?
Hi guys, I'm so, di ba nagsisink in? I'm so amazed.
Yeah.
Doc, thank you.
You're welcome.
I went here in full confidence and trust with Doc. I've seen her work. Guys, I am a person who really does the research before really, committing to this. And I want to be happier, to be more confident, It doesn't mean na maganda tayo, we can just stop. We have to take care of ourselves and we can't deny that we are aging. So, not only with that, I really appreciate because hindi lang ito, I also got advice, beauty tips from Doc. Really, it's a holistic thing.
Yes.
And I am just so blessed and thankful. So guys, if you are also interested, you can always message them. They're available. Someone will reply in your inquiries.
Yep.
And everyone's so approachable. And I really, I'm so happy I found my new home here with Doc.
Yes. You're welcome, Cassie. Thank you so much for being with us, okay, and for trusting CSA. For those who have questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. And our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And Cassie, do you have like a social media account in case they just want to ask a bit about what we have done today?
Oh, yes.
If you can just give them some advice.
Guys, if you want to know more of my experience, I am so happy to help you. You can reach me on Instagram or Facebook. It's Casibang, CASIEBANKS. I would be so glad to walk you through the process and give you comfort that needed. Pero hindi na kailangan, it's so easy and actually painless. I told Doc, I have really low tolerance.
Low tolerance.
All throughout, it's very soothing and merong moral support all throughout. So I really appreciate it.
Thanks, Cassie, for tolerating those procedures, okay?
Perfect.
So we'll still do a follow-up on her plus another treatment on the V-shaped contour of the face. And if you want to see our other videos, we have our YouTube channel, Contessa Salvador, and please do click like and subscribe as well. So God bless you, Cassie.
God bless, Doc.
Okay.
More power.
Praise God. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.